Hi, I'm Dr. David Rowe from Rowe Chiropractic Offices, and what we want to talk about today is scoliosis. Now, along with being experts on posture and misalignments of the spine, chiropractors have commonly worked with scoliosis effectively. As technology keeps improving, we keep having a better understanding about how to help the population, our patient population that has scoliosis. All right, so what is scoliosis? By definition, what a scoliosis is a deviation from the front view. When you're looking at the spine front view, it's supposed to be straight. But the scoliosis is a deviation from the front view, like we're demonstrating the spine. And if I flip this around, you're seeing the back of the spine of over a 10-degree angle. So if we measured this angle, it would be over 10 degrees with rotation and postural changes. So the scoliosis has to be at least 10 degrees with rotation, postural changes. That's the definition. Now, it's commonly associated that scoliosis, we kind of oftentimes think about it as though, the adolescent, even more commonly the adolescent female with a deviation, a misalignment of her spine that the family's debating whether to use a brace or not. When we look at the adolescent population, that it's typically about 2 to 4%. So although it can be a very, very important issue for any individual that has it, for any family that's dealing with a family member with it, when we think about it, 2 to 4% of the population is not great. But there's another type of scoliosis that is way more common, and it's what we call de novo. It's an adult onset scoliosis that's caused from a lifetime of misaligned posture that gravity just keeps pulling us deeper and deeper into. So scoliosis can happen at any time in life. We have the rare incidence of infantile scoliosis. We could have juvenile scoliosis. We could have adolescent scoliosis. We can have adult scoliosis. And when we say that in the adolescent, it's 2 to 4% of the population. If we're lucky enough to live to be 85, it's over 40% of the population. So we see that these numbers really rise with uncorrected spinal postural subluxation. All right, so that's what the problem is. Well, what can we do to help people? The technology and the advancements on scoliosis treatment has been in a really steep learning curve recently. For years, they have typically used braces with very modest success because the brace theory was to create kind of a constricting brace to hold that scoliosis, maybe push it in a direction, but because they were compressive in nature, they typically were not very effective at actually reducing the scoliosis. Now, sometimes the patient would wear a brace. Let's say a brace was put on an 11-year-old and they wore it till they were, it was a female until she stopped growing at 15. They've been doing updating x-rays. They see a 5-degree improvement in the angle of the scoliosis. They're saying, great, we've arrested it. We've kept it from getting worse. Maybe we've even gained a few degrees. But because of the constrictive nature of the brace, when they take the brace off, it's common that the gains that were accomplished actually reverse and maybe even get worse from there because the brace actually destabilized the spine. But with a better understanding of the scoliosis, we know that the scoliosis has, as one of its components, because of gravity, a compression component. So if we can elongate by creating some kind of an elongation process, we can pull up on the spine, and that can decrease some of the stress as well. All right, what else can we do? Well, understanding that this pattern here is actually a combination of side bending this way and shifting this way. So how do you make this scoliosis pattern? Shift the spine to the left and side bend to the right. If you took an x-ray of me, it would look something like that. So since we understand the pattern of what makes the postural deviation, what makes the shape of it, we understand what makes that, let's go opposite. Let's elongate, side bend this way, and shift that way. So if we elongated, side bend this way, and shift that way, we've reduced, let me get this out of my face, we've reduced the misalignment. Okay, fantastic. So the the 𝐂𝐐𝐫𝐿 company, which has done some amazing research in terms of advancement in improving scoliosis, has come up with both a brace and a set of exercises, or a system of exercising to reduce the pattern. They call it �ＳCOLI-BRACE and �ＳCOLI-BALANCE. The �ＳCOLI-BALANCE is the therapeutic exercises, and the �ＳCOLI-BRACE is the actual brace. Let's look at how the brace would work. So if the person has a pattern that they have shifted this way and they're side bent this way, we could build an asymmetrical brace like this. And if you notice on the brace, let me put it to the back, that the brace is pushing in there and there's a cutout here. That's creating a shifting in the spine. So I'll go back to the front. The brace would be put on like this. It creates a shifting this way and a side bending that way. The brace goes exactly opposite of the pattern. We also see that the brace is kind of built high. Well, the brace would fit underneath the axilla, the armpits of the patient, elongate, lift them up a little bit, that decompresses the spine, creates a little bit of improvement in its own right, but then side bends and shifts, and holding the patient in this position for, if it's corrective, let's say for a 13-year-old, for 22 hours a day. They're wearing this brace, they're sleeping in it, they're just taking it off to shower and for sports, but it creates almost like an orthodontic remodeling of the spine. And as the adolescent goes through the growth spurts, they can actually create some true correction. Now, we're very careful not to say, don't worry, we'll put that brace on and we can guarantee that we're going to reduce it. But as the brace technology and our understanding keeps improving, coupled with the use of this �ＳCOLI-BALANCE procedures, we can commonly create some reduction in the scoliosis while they're going through those growth spurts. All right, how about the senior? What happens with a person that has a degenerative scoliosis where the spine is collapsing because it's degenerating? It will be more difficult to make those changes, to make corrective changes, but the brace can be incredibly helpful in terms of supporting our patients. So while they're doing the activities that they want to do, they're supported so they're not being collapsed. So say, like, what do you mean activities? Well, like, say a person loves to cook, but they're saying, I can't stand in the kitchen anymore for the 3 hours because it just causes too much low back pain. But if I put the brace on and it lifts me up, side bends and push, I can actually, it takes enough pressure off of me that I can go ahead and cook a full meal, do the dishes, and be comfortable enough. I'm working at the computer, doc, but it bothers my low back so much. We put the brace on them, they're saying like, oh, no, I can work for a few hours at the computer, get my work done, enjoy watching videos, sitting, watching a movie. I can do a lot more because the brace is supportive. We've definitely found that the rehab part of this, the �ＳCOLI-BALANCE, is incredibly supportive in the process of correction. Now, there's other things that we can do as well. The Dental company makes a specific dental called a Scoli roll, which we're going to go back to this pattern, and where the person is like this, we can have them lie on the side, and the Scoli roll pushes them in that direction. They lie on it 20 minutes twice a day. It can also be corrective. Certain chiropractic biophysics tractions where we could set the patient up and traction them in this situation. In the traction units that you see behind me, I think you can see them, we can use the traction units as a adjunctive therapy to also correct. How about specific chiropractic adjustments? Person has a deviation, a side bend, and they're in this pattern. We can create corrective adjustments that go opposite, doing the drop work, doing instrument work. The chiropractic work that we do to analyze the postural deviation can be beautifully adapted to help people with the scoliosis. Now say, what's such a big deal? Okay, it's not ideal if somebody's spine misaligns, but really, how does that affect their life and their living experience? The longer the scoliosis goes on, the more impact it will have, both in terms of causing neurological stress. It's associated with pain. If we can improve the scoliosis, first identify it, and then come up with a strategy to improve it and manage it for a lifetime, it can absolutely improve the quality of life for patients that are struggling with the scoliosis. I'm Dr. David Rowe from Rowe Chiropractic Offices, and that's your general intro to scoliosis.